Welcome, Renee. Great. Okay, Veronica, could you take me back to the first slide? Thank you.
Does not look like it wants to work with me today, so just manually do it. Here we go.
Once again, everyone, welcome. Thank you so much for joining us today. We're going to start right now with our wonderful town hall. Once again, welcome everyone to our Reach Out and Read book funding for Reach Out and Read program town hall. If you haven't already, please write your name, role, and site name. We would love to see where you're joining us from. Let's move to the next slide. A few items before we get started. We would love to see you, so please turn on your camera. If unable to do so, that's completely fine. We do ask you to please make sure you're muted throughout the presentation and only unmute yourself if you have any questions. We encourage you to use our chat feature for questions, and one of our team members will make sure to address it. Next slide. Wonderful. For today's agenda, we have welcome and introductions from Reach Out and Read of Greater New York team. We have a quick town hall poll for you guys to look at either now or at the end of the town hall. We're going to send it in a resource package at the end of this town hall. We're going to receive a book buddies update from our senior manager of books and literacy, a quick update of progress reports, site visits, and resources from the medical engagement team. And of course, after that, we're going to continue with our wonderful panel, the book funding for your Reach Out and Read program panel. Next slide, please. Wonderful. So again, everyone, welcome. My name is Jessie Licio, and I am the Senior Manager of Medical Engagement for Reach Out and Read of Greater New York. I'm going to pass it to my colleague, Sejal.
Hi, everyone. It's great to see all of you here today. My name is Sejal Kathari. Many of you know my emails by now. I'm the Senior Manager of Books and Literacy. I will pass it on to Megan.
Hi, I'm Megan Fair. I'm the Senior Manager of Development here at Greater New York. And I'll go to Emily.
Good afternoon, everyone. It's such a privilege to join you all this afternoon. I'm Emily Marchese. I'm the Executive Director of Reach Out and Read. And just while I have you all very prescient for today's topic of fundraising, I did want to mention, I'm sure many of you are seeing in the headlines a lot of talk about the mayor's cuts, pending cuts to New York City. And our coalition with Cities First Readers, could be impacted, but certainly early literacy initiatives, including the New York Public Library, has already been affected. So if you're available, we know it's short notice, but there is going to be a rally Monday morning at 9 o'clock at City Hall to champion early literacy initiatives. The Reach Out and Read team will be there, along with our partners at Cities First Readers, to make sure that council members know how important these initiatives are to New York City families. So we'll put some information in the chat. Please feel free to join us if you're able and get the word about this important initiative. And with that, I will pass it to Jack.
Hi, everyone. My name is Jack Downs. I'm the Development Coordinator for Reach Out and Read of Greater New York. Last night, if you are on our email server, you received an email from us for our newsletter for this quarter. So I encourage everyone to take a look at that. There's a lot of really important information regarding book deliveries and all types of updates for Reach Out and Read of Greater New York. So thank you so much, and I'm excited for today. And I will pass it to Veronica.
Hi, good afternoon, everybody. I am Veronica Hitchin. I am the program coordinator for the medical engagement team at Reach Out and Read of Greater New York. Really excited to be here with you today, and I'll pass it back to Jessie Licio to carry us through.
Thank you, Veronica. Can you go to the next slide, please? Wonderful. So as mentioned before, we have a quick town hall poll for you guys to fill out whenever you can, if possible now, if not at the end of this town hall. As a reminder, the town hall provides the Reach Out and Read network a space to connect, get ideas and resources for you guys to use it at your site so that your site can thrive with Reach Out and Read. So of course, we want to hear what ideas, topics you guys would like to hear in the future. So please fill out the survey whenever you can. And then with that, I'm going to pass it to my colleague Sejal for a wonderful Book Buddies update.
Thank you, Jessie. So many of you are familiar with our Book Buddies program at this point, so I'm going to just zip through some quick updates. Again, just in the interest of time, if you have questions, please drop them into the chat and I will be sure to get to them. So at this point, many sites are in receipt of Book Buddies shipments from our spring order. Historically, this was actually our largest order to date, with over 350,000 books distributed to over 145 of our sites, and all with diverse, relevant content to our children and our population. So very exciting. If your site did not receive a delivery, please ensure that all the data in My ROR is up to date. We are relying on that to assess book need, book distribution, SQC ratings to determine order allocations. The reason that's bolded is just to make it clear that we have a very objective process in terms of how we allocate books. We don't want anyone feeling quote unquote left out. Obviously, we're trying to increase access, but at the same time, we need to have some kind of objective measure to figure out where the books should go and how many. So just please make sure that all of your data in there is accurate and up to date. We also want to make sure that the shipping addresses are correct. And some of you who are on the call will know and have been working with us very well to handle some last minute changes or snafus that happen with some of the larger deliveries. We want to make the process as smooth for all of you as possible as well. We know how busy all of you are with all of your other responsibilities. So please go into My ROR where you can edit your shipping information. If you were impacted by that in this delivery, please go ahead and do that while it's still fresh in your mind. And also for anyone else who is hearing this and thinking, oh, we recently moved locations or we had something that would affect this, please go ahead and note that. And also, if for whatever reason your shipping address is a residential address, please note that in parentheses. A lot of the freight companies cannot deliver to a residential address, and that would give us time to find an alternate plan for you. So, and also if people can just please mute if they're not muted, just getting some background noise. Thank you so much. So Fall Book Buddies, that's happening now. We are focusing on broadening our language scope. Haitian Creole, Chinese, Arabic, French, Bengali, Somali, and Portuguese are all the languages we're aiming to include this go around. We are including Spanish again. And we're actually partnering with other ROR affiliates across the country, which is why there were requests for some other languages than we might typically see, although I'm sure we have children who need Somali and Portuguese right here in Greater New York. We're going for 100% bilingual, which allows access for more children. I know some of you have asked about that before, but if a child speaks English and not another language in the home, it's okay. They can always access these books because there's always English. We want to make sure other children can access as many of our books as possible. If you know that your site has a specific language need that you see in this order here, many of which are underreported in My ROR, please contact me at this email ASAP. I'm going to be making the purchase order towards the end of December, beginning of January. So if you say, oh, wow, we would really love books in Chinese at our site, please let me know that. These deliveries will happen in the late spring, but as I noted, the order will be going out early winter. And please note, again, we always say this, we cannot guarantee book need requests with less than 2 months notice. That's everything I have here. I'm going to move it on slide wise. And again, if you have questions, drop them in the chat. Thank you so much.
Thank you for that, Sejal. Just as to flag it for all of our sites, we do have our next round of progress reports coming up in January 2024. This is part of our biannual progress report cycle that occurs in January and July. It helps us incredibly with tracking book procurement and distribution and your patient demographic and needs, especially as it relates to language, which directly ties into our Book Buddies orders. And more than anything, it helps us secure more funding so that we can provide more books to you. For the previous progress report cycle, it launched in July 15th with a hard deadline on October 1st. And we hosted 3 office hour sessions to answer any questions, provide any help that we can in completing this report. And of all of our 219 sites, we had a percentage completion rate of 87%. Looking forward, the next report cycle will launch in mid-January of 2024. You will be getting a lot of emails from me as that time is getting clearer or getting nearer, and I will be sending out the official date when we receive that. And as always, we're aiming for 100% completion rate. So if you have any questions at all, please feel free to reach out to me so that I can help you in completing this report. Another project that the Reach Out and Read medical engagement team is working on is getting back to our in-person site visits. So if you have received emails from either myself or Jessie Lizio requesting a site visit, please get back to us. These site visits are required to occur annually. And if you haven't heard back from us, feel free to reach out so we can get that scheduled for you. It's a great opportunity to check in with your sites, see where the strengths are, and create an action plan to move forward and become even stronger. As well, we are also able to provide a lot of additional resources during and after the visit as well. And I will pass it over to, well, here are some of the examples real quick of things that we're able to provide for you, such as site coordinator manuals, one-pagers talking about different aspects of the program. And I will pass it over to Jessie to introduce our panel.
Thank you so much, Veronica. I have the great job of introducing the book funding for your Reach Out and Read program panel. I'm going to start with Megan. Next slide, please, Veronica. I'm going to start with Megan first. She's our amazing Senior Manager of Development for Reach Out and Read of Greater New York. She will be our incredible moderator for today's panel. Welcome, Megan. Our first panelist is Dr. Leora McGillner. She's an Associate Professor of Pediatrics at the Icahn School of Medicine at Mount Sinai, where she oversees the resident training in advocacy and community pediatrics. And she's also an Associate Program Director for the Pediatric Residency Program. Dr. McGillner founded the Mount Sinai Reach Out and Read program in 1997 and has been Medical Director of Reach Out and Read of Greater New York since 2009. She was one of the founding board members of Reach Out and Read of Greater New York and still serves on the board. Welcome, Dr. McGillner. Our second panelist is Francine Codler. Francine is a 2021 recipient of the Whole Family Advocate Award for Reach Out and Read of Greater New York. She's an Early Intervention Service Coordinator with the Brownsville Multifamily Health and Wellness Centers. Francine has expanded the Health Centers Literacy Initiative with Reach Out and Read from a clinical program to an expanded community effort, BMS Books for All, that distributes over 5,000 books annually to area residents. For this effort, Francine was awarded the Sesame Street and Community Leadership Award in 2018 for her literacy promotion in East Brooklyn. Welcome, Francine. Our third panelist is Dr. Nelly Macida, who is a Director of Pediatrics at NYC Health and Hospitals at Mauriciana. She has done a wonderful job for advocacy with her families promoting early literacy at home. Welcome, Dr. Macida. Our last panelist is Dr. Katrine Bolura from NYC Health and Hospitals in Queens, who has established for the past 26 years meaningful and enduring relationships with her patients and families. Dr. Balura most likely won't be able to join us today for today's panel, but we still wanted to give her a big shout out since she was part in the collaborating process for structuring today's town hall. Thank you all. And with that, I'm going to pass it to Megan.
I didn't realize I was on mute. Okay, thank you, Jessie. Thank you everyone for joining us for this fundraising session today. I do hope that during our talk that the ideas and the resources that we share inspire you. We're going to keep it short and sweet, and all of the materials that are discussed will be shared in the resource packet by the medical engagement team after the meeting. So everything we talk about will be available. So first, a little housekeeping. I do want to note that if you are working at an organization or within a larger institution that has a designated development department or a development team, I do highly encourage you to always communicate and coordinate any funding efforts with that in-house team. So then that way everyone from your organization is just on the same page about what is being pursued and when. And it could also be a really nice moment for you and their department to really connect, listen, and learn from each other. So that way you can kind of decide if there are any maybe opportunities that the in-house team may or may not be pursuing for you in your office. Your experience and your knowledge about the needs of the families that you're serving right now is truly invaluable. Your insights are unique to your perspective, so I do encourage you to share these with the development team so it can also help inspire them with identifying and creating any sort of funding opportunities as well. So just wanted to start off with that, but if you do not have access to a resource such as that within your organization, we do hope that today will help provide you with some information to help kick the fundraising ball off for you. So without further ado, we will focus on 3 ways to help raise money and generate revenue for your site to help bolster your book budget and your book supplies. So the levers that we're going to discuss today are events, in-kind donations, and grants. So let's kick it off with events and with Dr. McGillner. Dr. McGillner, I know that you have some experience with book fairs at your clinic, and so I just wanted to ask for some of your stories about your experience in hosting these kind of events for Mount Sinai.
Hi, good morning, or I should say good afternoon, everyone. So there are a couple of different types of events that we've done to varying degrees of success. I think one thing that's been successful, and I know this depends on sort of geographically where you're located, but partnering with schools in your neighborhood, or doesn't even have to be that close by, but we've had some really successful book drives with local schools that have either done events where they have kids bring in their used books, and I stress like gently used books, or if they, for holidays, are doing a holiday drive and they want, some places will do like an event where they'll bring a gift for a child, or not a gift, but a book. So that's been very successful. I will say I'm very selective who we do book drives with, because in the past we've gotten, donated books that were not in great condition. So I just caution, but if you know who you're dealing with, we also give out books to kids who are older, let's say out of the age range of the Reach Out and Read program, just for siblings and things like that. So I think those like chapter books are especially easy to donate because they're usually in good condition. So book drives with local schools is one. We've also partnered with individuals who are doing events. So a big one is bar and bat mitzvahs. I've had people reach out to me when their child is becoming a bar or bat mitzvah, and it's really a special thing to include a good deed as part of that, or a charitable event or activity. And we've had occasions where people will ask, say, when you come to my party, please bring a book for a child in need, or a book that you love, bring a copy for another child. We've also had people, ask their guests to make a donation. So in lieu of a gift, make donations to Reach Out and Read at X. I think money is probably the easiest for you guys, for everyone to deal with, but because then you can buy the books that you need. But I found that those events were also really helpful. So partnering up, whether it's, we had a girl who had friends donate books for her bat mitzvah, and then her mother drove it. They were in Long Island, and they connected with me because the child had received a kidney transplant at Mount Sinai, and she wanted to do something for the kids at Mount Sinai, and they drove it in, and that was really wonderful. We got great, beautiful new books, and the child and her friends were able to do like a really nice good deed. So those are just a couple of things that we've done. I think for all of them, you need to have a point person. You need to have someone who's going to be the point person. That's usually me. In the past, and I also just caution, if you are going to do a book drive where kids drop off stuff at school, I would really encourage you to, when you're dealing with schools, to ask them to please deliver this stuff to you. I've schlepped many a box, and it's not so fun. I don't know if you wanted me to talk about more, but those were a couple of the big ones that I had found are helpful. And I think especially if you want to get some books for older kids, or if you're in a neighborhood where there are private schools or schools that have, let's say, community service as part of their mission, those could be potentially good partners.
I think that's wonderful. Thank you. And I think the bar and bat mitzvah idea is also a really, it's a unique perspective too, with how, families having their own milestones in life and celebrations, as to using that as a lever to help bring in support for your site. I think that's really wonderful. Dr. Masita and Francine, do you actually have any examples for us too of how either events like Dr. McGillner shared or book fairs have helped you with your clinics as well. I don't know.
Sure. Sorry.
Oh.
Hi, everyone.
That's
How you
okay.
doing?
Hi.
I'm so sorry. I was so fascinated by Maria de Ursa's backdrop that I was just looking at it the whole time. She has me in the spirit. The spirit is now back. Thank you so much for that, Miss Maria. So my name is Francine. I'm the Early Intervention Service Coordinator at BMS. I take care of the mommies through their entire pregnancies and their children to their 5 years of age with their social determinants of health. So one of the ways, one of the examples of the in-kind requests that we have made through these kind of partnerships is we have a range of partners who provide a variety of support. I conduct outreach in our patient areas and also receive referrals from clinicians. I use a checklist of resources during intake so families can identify what resources are needed, and these services are then documented to their chart. So let me give you one of them. Broken Book Bodega. They actually supported me a couple of years back when we were at a time where we were in need of books. Our books that we usually get are for 0 to 5, and they have to be given out during a well child visit. But at one point, I felt that it wasn't fair that the rest of the children in the waiting area and or their siblings were not entitled to a book. So I spoke to Ms. Renee about it. We built a program called BMS Books for All, which allows every child, regardless if they're having a visit or not, whether they're a patient or not, to be able to get a book as long as they come into the center to receive it. We were at a point where we had almost no books to provide. The books we had were only for the well child. So Brook and Book Bodega supported at that year by providing hundreds of books in one pickup, which allowed us to continue our extended books distribution through our BMS Books for All program. As I stated before, the program allows us to give to persons whether they are patients or not through site activations. It also allowed us to be able to build new partners as we were able to donate a portion of those books to another organization who was in need, such as Camber Cornerstone, just to name one. This effort allowed us to have one of our OBGYN providers to become interested in this initiative, where in her workspace, she built a reading library for prenatal moms who came in, as well as for the children, and she named it her Harvard library. So those are one of the ways that I was able to get that information that is being requested as well. We host baby showers quarterly where patients who are near their due date receive all the supplies necessary to welcome a new baby. And that's one of them.
Thank you.
Thank you.
Veronica, if you can go back to slide 13 for me. I think it's one more before that. There you go. So in addition to what Dr. Mogilner, Francine shared with us, those are great examples like the community baby shower too, for how you can really use your networks to come together to support your clinic and each other through events. So we just wanted to share some ideas with you as well, in addition to what our panelists have shared today. So there is also the good old fashioned, there's the book fair, not just a book drive, but the fair, which could be coordinated between you and an independent publisher or an independent bookstore, where you can hold a book fair to sell reduced price offerings to your communities. You can solicit book donations for that book fair as well, like we talked about, either through colleagues, friends, schools, local libraries. Like you can reach out to other resources as well to get books for that outside of the publisher angle. But at the end of the day, ultimately what this would do is that a proceeds, a portion of the proceeds from the sales at the book fair would then go into your book budget. I know that we have some history too. I believe it's Claudia shared with us some examples from Bellevue, where they partner with Billy Books. They have throughout the years where a portion of their proceeds will go into their book budget. And this will be available in the resource packet for you after, so you can see more examples. But then some other fun ideas outside of book fairs. There's an idea of a restaurant partnership where you can form a relationship with a local restaurant, ask them to have like a day that would support your clinic. So a portion of their proceeds for that day would then go back to support your book budget. So then that way you would raise awareness of the Eat at Whatever Diner Day at your local clinic. And then you would work on getting your community to eat there. And then that way you can have some of the portions go to your book budget. There's also a fun idea of a 50-50 raffle, where even at the holiday season, you can sell tickets for $1, and then at the end of however many weeks this raffle lasts, half of it will go to your clinic, and then the other half can go to a winner ticket that was chosen from the raffle. So that way something's going back to your community members. They have a little skin in the game, so to speak, more than just the wonderful books that they'll be receiving, but then some will go to your book budget as well. There's also endurance related events and readathons. So by endurance events, we mean those are all the races that happen, like turkey trots, 5Ks, where you can raise money for causes that are close to your heart. And again, you solicit your networks, your colleagues, your family, your friends, to help garner support on a personal level for these bigger causes that you're trying to support. So when it comes to endurance related events, there's a couple ways of fundraising for that. We'll share some examples of resources for you today. There's peer-to-peer fundraising, where basically everyone makes their own fundraising page online. This is an example of a Facebook fundraiser. They encourage people to give to a cause, and then the money they raise through their page goes to the cause. There's also crowdfunding. It's rooted in the same sort of shared giving, but there's really a centralized page where everything is going to go. So example of that would be GoFundMe. I know we all are familiar with those campaigns that families often create too for reasons for themselves. In addition to GoFundMe, there's also Spot Fund that's available to use for these resources. And there's
I'll be there in like 15 minutes. Yeah.
Oh, pardon me. There's also a resource called Give Butter,
which that's fine.
Provides peer-to-peer and crowdfunding capabilities. And as a reminder, if everyone can make sure they're on mute, that would be fabulous.
Okay. Oh yeah, so you're out after today.
Oops, little. Anyway, all right. So when it comes to events, the core group of that are going to be supporting your events are, of course, people and any of the partners that you bring in.
So you're doing nursery next week.
I'm so sorry.
Lewis, could you please mute?
Okay.
Lewis, I'm sorry. I don't know if you hear us. Okay, thank you. So anyway, we have some resources here for you that are free to use. The people in your communities, the partners that you form, are all going to help you make events happen. So really what we want events to be for you are, they take a lot of time, they take a lot of energy, like Leora mentioned. So the less that can be in-house for you and the more you can partner with other community members, the better, because we know you're all really busy and you're short on time. So we want the events that you're doing can just bring in that money to support your clinic. Okay, so if we can go to the next slide, Veronica. Thank you. We talked with Francine about BMS and all the different types of partners that she receives through Books for All. If you go on the next slide, there's just a recap of some of these partners. Again, these will be shared in the packet. I'm kind of speeding it up now because we're short on time, so sorry. If we go to the next slide, a lot of what Francine was talking about too was in-kind donations. So really what those are, they're goods that you're just going to go out into your community and to other resources to help bolster either your book reserves or gather materials that you would need to help make your waiting rooms more literacy rich, more creative, more colorful. So you can get a wide variety of in-kind donations from free resources across the city. You can get books, you can get furniture, whether it's for your own offices or for your clinics. You can get arts and craft supplies for the kids, whether again, it's in the clinic or for events. There's toys, there's clothing, there's food and beverage, which can also be used to support events. You'd be surprised how many cafes are just willing to give you tons of coffee and donuts, and they feel like they did a good deed and they saved you some money, and you're providing some nice refreshments for your folks at the end of the day. And we also love the idea of a book house. So this would be an example of you could partner with either a local high school or a college or a vocational school that has woodworking or metalworking classes. You would ask them to create a book house for your clinic, and then it could be a little take a book, leave a book, so to speak, house in your clinic where you can encourage this community sharing for your families. And it could be for books of all ages. You could limit it to certain ages depending on what you're interested in. But a book house is, again, another example of an in-kind donation from an organization that would provide the house, and then from families that would be helping to bolster the supply of the books that are within the house itself. So we just wanted to share some examples of those for you. If you can go to the next slide. Here are some online resources that you can find some free donations. They include Donate NYC, Materials for the Arts, and Liquid Donate. Materials for the Arts is a creative reuse center here in New York City that you can go and find really amazing materials at. It's free to join. There is an application process. I think it takes about a month to go through, but you can get access to a lot of really cool, creative, fun materials within Materials for the Arts. And Liquid Donate actually partners with retailers on overstock and oversupply within their own, industries. And so you can get access to books, clothes, furniture. It'll depend on your location, but it's a really cool resource to go and get great, gently used, if not at all used stuff for your clinics. And of course, in person, they can be for book drives like we were talking about earlier with Leora and Francine through community members. You can partner with thrift stores, libraries, schools, independent publishers, bookstores. There's so many opportunities for you to go out into your communities and get some free items to help make everything you're doing bigger and better on site. Okay, so Dr. Maceda, I was wondering if you had any examples for us too of either in-kind donations or events that have helped you with your site. And I don't know if she's still on the call with us. I know Dr. Ballora couldn't join us today, but I wanted to make sure to hear from Dr. Maceda if she was still with us.
Megan, I don't see Dr. Maceda on the call,
Okay.
so yeah.
Okay, great. All right. I can't tell from my little all the little squares, so I just wanted to be sure. Okay, great. All right, so we're going to move on. I know we're almost at time. The next category would be grants. So grants is complicated. It's also, this is a very oversimplified example. Again, if you are working in an organization that has a development team, please work with them on this because they are going to be much more in this pipeline and they can definitely help support any ideas that you have. And also you can help inspire them with any ideas that they don't yet have. So grants come from a few resources. They're from private and public foundations, public government funding, and also from corporations who have giving wings and charitable giving causes that they would like to support with their own good corporate citizenship, as we call it. So Dr. Mogilner, I know you have experience with grant writing. So before we launch into it, can you share a little bit with us about your experience in that part of fundraising and also any examples that you've kind of crafted for Sinai that either could maybe be outside of the box that maybe folks wouldn't initially think of, or you found to be really effective?
I think the main thing I would want to say, which was mentioned already, is to make sure that you partner with your development office. If you're at a place, if you're especially at an institution, or even I would imagine any clinic that's a nonprofit, you want to make sure that you're not and I mean this like politically speaking, you want to make sure that you're not stepping on anyone's toes, or you're not thinking about going to a funder that the hospital or the health system may want to be courting for a much larger gift, and then you go ask them for a smaller gift and they may be very upset. So I think for me, being partnering with the development office, and the flip side of it is making yourself available to both development and to marketing and PR. Because what I'll do is I'll say, hey, if you need someone to talk about literacy or relational health or community, social determinants of health, I'm happy to do it. And then I'm sort of front and center of their minds when they need someone. But also if a funder comes in and wants to give something, whether it's early literacy, education, social determinants, they're thinking of me. So I think it goes both ways. If you make yourself available and you can become the expert for them in that area, then when donations come in or a funder is interested in a particular like child health related giving, you'll be the person that they think about. Now, that being said, I've also had grants. That's for private foundations. Any public grants, I also have to go through our grants and contracts office. So for those of you, again, who are in these big institutions, I always have to ask my bosses, go through our grants and contracts office. Those I think are less applicable. It's more the smaller foundations, corporations, things like that, where I would partner with them. And I think, maybe there's some grants I tried for, I didn't get, but then the next time a funder like that comes around, our development office will come to me. The final thing is sometimes you can get money for your Reach Out and Read program. If those of you have residents, sometimes there are resident grants or training grants or education grants or advocacy grants through some of the pediatric professional organizations, AAP, APA, APPD. And I would just say, get yourself on every mailing list so that you're seeing all these things. Sometimes it's through research or training, and there's a way to get books for your program or get a service for your Reach Out and Read program by partnering, whether it's with the resident or a new faculty member or something like that. So.
Exactly. And I think too, there's a good opportunity for inspiring any existing development teams, or if you don't have one available in-house, trying to think outside of the box necessarily to what it is that is being provided. So there's always kind of little bright spots and opportunities that funders might not be aware of and that you can help draw those connections for. So if there is a funder, for example, that's really focused on nutrition and, you know, food security and things like that, perhaps your clinic is already involved in food drives or food distribution, and, you know, you could work on crafting a proposal that would encourage food or nutrition related books at the clinic, but then also help support the food distribution that you're already doing to support your community. It could also be related to any sort of, let's say, support, like Francine mentioned earlier with the community baby showers. It could be involving maternal health and any sort of maternal health outcomes and uplifting that part of your community, and how what we're doing in the exam room with providing these books to empower mothers and caregivers to, you know, be these resources for their children, how that also can impact positively the mother's health and well-being too, in their postpartum and their, you know, early motherhood journey. So there may be angles too that are available that funders might not realize, oh yeah, that can work for us, or that your development team might not realize your clinic is already tuned into and doing. So it's just a great example as to why, you know, your unique perspectives are so important. And so if you have this team, to just have that moment to connect with them, listen and learn and see what you're all working towards, and then inspire one another, because I'm a true believer in a rising tide raises all ships. So I do think you're all in this together to get the funding to push your shared mission forward so you can do it. For sure. I believe in you. All right. So with the next slide, please. This is, again, a very oversimplified process for if you're going to pursue on your own because you don't have the resources available to you, or just to have more insight into what this development department is doing. When it comes to identifying and securing funding, there's a few steps that always happen. So first, there is research and identifying the funders, confirming that the resources that you've identified for funding match what it is that you are seeking funding to support, what your clinics are doing. Also confirming any sort of strategy around, like we said, maybe drawing connections that might not be widely apparent at first to funders, making sure that strategy is clear. You then go into a brainstorming session of how to create this proposal, what you're requesting funding for. You then go into the application process, which is complicated. It will vary among all funders. So it is very important to always be aware of what those funding requirements and deadlines are, and to keep track of them in whatever your own, you know, tracking system is, with checklists and materials that are requested. They're going to be different for every funder. Some will be as particular as margins and font size. So it is important to just be acquainted with all of those throughout the application process to make sure that you're really fulfilling whatever those requirements are that they need. And then once an application is submitted, there's follow-up and cultivation moments that you will be it will be within everyone's interest to pursue, and then to connect with the funders and most likely arrange in-person site visits to get them to come to the clinics to see what's happening in real time. And then that way everyone can learn what everyone is doing if they're unfamiliar with you. Next page, please. Okay, so this again is an oversimplification, but I wanted to provide it for everyone so you had some insights on what a grant life cycle would look like from a grantee perspective, which would be you know, from our perspective, requesting the funding, and also from the grantor's perspective where they're dishing out the funding, so to speak. So this really kind of recaps, in a sense, the steps that we just talked about before and how they intersect with one another, from articulating your ideas, developing the proposal, submitting the application. And what we haven't really talked about is post-award, but there's a whole process of managing the award after it has been distributed. If it's launching a project or just scaling a project and growing it, you know, what the parameters are around that. And then eventually all grants will require you to report out on your performance, so to speak, with what you did with the funding, and if it was used in the way that you requested, and or if, like, A++, if it was used in an even bigger, better way than outside of what you requested, which is always a great thing to share with funders as to how their money went even further than you expected, which is something they always love to hear. And then the cycle starts all over again when renewing the funding for additional years. So this is just an insight into those grant cycles. I hope that this is helpful if you don't have experience in grant writing, or if you do. And again, this will all be available in the resource packets that we're going to share after the meeting. Next slide, please. So this is an example that Renee Muir kindly shared with us from BMS. examples of how funding also is a long-term game. It may not be quite as simple as, oh, I found it, I'm going to get it. It might take years of building your programs, of building these relationships before it can really come to fruition in terms of funding. So don't be afraid of that. It's never too late to start the process of this. And if you start now, it could lead to large results for you later in time. And as shown here with BMS, you know, this process started as long ago as 1999 when Reach Out and Read first came to the clinic, but then ultimately forming the program, scaling it slowly over the years. Ultimately, what it led to was securing this increased support in 2020 and in 2022. So this is just an example of how institutional funding may not happen overnight. It most likely doesn't, but the payoff is big at the end of the day. And so whenever you start to lay this groundwork, and when your teams in-house are laying this groundwork, know that they're playing this long game here. And like Leora mentioned earlier, with certain funders, they may be cultivating them for a significantly larger gift. And even if you have a smaller one in mind, there's probably a more strategic process in place in terms of thinking about this holistically. So just to keep this in mind that, again, you're all working for the same goal, but it might take a little time. Next slide, please.
Megan,
Yeah.
Renee just raised her hand. I'm gonna let.
Great. I'm sorry, I didn't see a raised hand.
No worries. I just wanted to add with the funding that this is a really wonderful time now for sustainable funding, because these have been kind of one-offs. And I know you're going to talk a little bit about the community health worker initiative, but there is also the 1115 waiver that is going to kick off in New York. The feds did it already and you can take a look at the model, Making Care Primary. And so there's a potential opportunity there as well to secure funding through the 1115 waiver for these types of initiatives. And given the fact that they funded the 1000 days pilot, I think that, you know, they definitely value this program. And I would begin to ask your development offices to look at how you can articulate the tie-in between this initiative and things that are probably at the top of the food chain for Medicaid, which is increasing access to care in addition to providing improved outcomes. And so what Francine did not mention is that oftentimes the community book distribution is how we identified uninsured, underinsured, or mothers who were not in care, children who were not in care. They start with coming over for a book, and then we're asking, do you have a primary care home? Yes or no? And so we were able to identify a huge number of community residents. So even taking creative approaches like that in terms of increasing access is one way with the 1115. But I won't steal your thunder about the community health worker, but 1115 waiver, take a look. It's $17 billion ask for this transformation.
There is no thunder stolen. It's as simple as that. I was just going to make everyone aware that this this community healthcare workers code is going to be, I believe, made billable through this waiver. And so it's an opportunity to move that line in your budget to a revenue generating line with this new billing code. So in our resource packet, we do have some links to articles explaining what this is and how it's happening. And like Renee said, especially if you're within this institution or area institution that has a larger development team, they might or may not know about it. So please make sure they are clued into this opportunity, because it is a really fantastic new revenue generating opportunity for your clinics and for your community health workers, which is amazing. So there's thunder stolen there, Renee. That was a great segue, and I'm so glad you spoke up. So thank you. And again, this is an example of some of BMS's funders, not just at the government level, as you see here on the right-hand side, but also at the community, in the private foundation side as well, with the Moringa Family Foundation. So, you know, with the right time and resources, you can build these kind of relationships, as this example as BMS has so wonderfully shared, with community partners, with institutional funders, in addition to just your own networks of individual donors that you're serving in your community. So I don't want to be like the opportunities are endless, but they kind of are. So it depends on what your needs are and what your resources are available to you as to what you'd like to pursue. All right, next slide, please. So we do have some how-to materials for you. Again, if you don't have these resources available to you, we want to help jumpstart it. If you do, hopefully this will help give you some insights as to what other folks on your team are working with. We have some grant content inspiration for you, including some one-pagers from our national organization, including how Reach Out and Read is a partner in literacy, how we're a partner in healthcare, and how the ROR program supports HEDIS performance. We have some examples with grant writing proposals for you. I have a narrative grant example, a grant budget example, tips for preparing a budget, a glossary of fundraising terms, pretty much anything you would need to know if you're entering into, especially this grant writing journey on your own. Hopefully this will help jumpstart you. And I'm also always a resource. If you have any questions, you're more than welcome to always reach out to me with those and I'm happy to help as much as I can. In terms of donor communications, if you do have any sort of individual fundraising events like those 5K races or turkey trots that we talked about earlier, we do have some email and letter templates for you for thank you letters, any sort of solicitation letters, as we like to call them, for securing donations. And then we also have some email templates for you for funders. So if you are submitting applications or inquiring about funding opportunities, hopefully these will help inspire and give you some sort of structure that you feel confident using to reach out to them personally. We also have outlined for you, which we hope are helpful, some tips in regards to site visits. So those are, we know you know how to do site visits, like they're your bread and butter, but they are just such an effective and meaningful tool in helping to build meaningful relationships with funders, whether they are an institutional funder like a government agency or a foundation, or even individual donors who have private foundations. It really helps build genuine relationships for them to really see what you do in action. So we've included some examples for how to plan a visit in terms of talking points for how to frame fundraising specific topics, which may not be comfortable for everyone, but really how to kind of make the visit a memorable and effective use of everyone's time, because we know you're all limited on that. So we hope that these plans help give a jump start to, if you are going to create these visits on your own, they can help inspire you to have a very fruitful visit with those funders. So next slide. Renee kindly shared some best practices from BMS's perspective in terms of patient outreach and engagement and service delivery. These are topics that are often going to be included in any sort of, especially institutional funding requests that you may be crafting, or that, again, a higher team is crafting. So this is just an example of like the breadth of material that can be available to you in these funding requests. And so we wanted to share with you this example that Renee provided, and her contact is also here on the slide if you have any questions for her about these. Next slide, please. And that is it for today. We kept it short and sweet. I went over 30 minutes by a little bit. I am so sorry for that, but I was trying to keep it quick. And this is a section that is complicated and not necessarily quick. So thank you for your patience and your time. If anyone has any questions, I can't really see the little things, but I don't know, Jessie, is anyone kind of raising their hand?
I will let you know if I see any hands.
Okay.
I don't see any hands, but as a reminder,
Okay.
oh yes.
Oh, no, I was just saying it seems quiet. We seem good. So, and you're always welcome to email me, again, with any questions too, especially about any of the materials that are shared in the resource packet. Okay, next slide. And that's it for the panel. Thank you so much, Dr. McGillner. Thank you so much, Francine. Thank you so much, Renee, for popping in. I didn't know if you'd be here today. I'm so happy that you were. And I know Dr. Valora and Dr. Maceda were not able to join us, but we're very thankful for all of your efforts in helping us create this panel today. So thank you so much. Next slide. I think, okay, there's some book ordering tips here. I don't know if we'd like to cover those.
They will be included in the resource packet because of time. We just want to move it along, making sure that everybody has any questions. So can we go to the next slide, please? Wonderful. And of course, we want to make sure that, as you know, you can reach out to us with any questions regarding, just to summarize, we discussed today site visiting. If you haven't heard from us, please reach out to us with book buddies. Make sure that addresses are correct and are on the system to make sure that every order goes on smoothly. And we want to thank Megan and the panel for such a wonderful presentation. I want to stop right there before we say bye to see if anybody else has any questions. Wonderful. I'm going to pass it to Emily then.
Wonderful. Thank you all so much for spending your Friday lunch hour with us. We're so grateful for your time and for the privilege to be able to offer you whatever support or resources we can. We're a small team, just like you all are small teams at your sites. So we know what it's like to be in the trenches, and anytime that we can be helpful, we endeavor to do so. So please don't hesitate to reach out with any questions or to share, what would be helpful to hear more about in the future. We're always open to how we can provide the best information for you all in doing the incredible work that you're doing. So thank you all so much. I hope you all have a wonderful holiday season, and that we'll be in touch soon. And big thank you to everyone who presented today or collaborated with us in order to fine tune the information. We're very, very grateful for all of you. Thank you.
Happy holidays, everyone. Thank you. Nice seeing you.
Holidays.
Happy
Thank
holidays.
you.
Thank you.
Yeah.
Thank you.
Bye-bye.
Bye.